Welcome everyone.
Yes, we can start. Thank you.
Great. Welcome everyone. Again, good morning if you're on the west side, and good afternoon if you're on the eastern side. Welcome to our training session and workshop today. This workshop is going to be done under the Rainbow Coalition for Refuge, and we are going to be discussing trans-specific gender affirming care and mental health for LGBTQI. To begin, I would like to acknowledge that I am a Rainbow refugee. We are located on the lands of Muslim, Squamish, and the Tsleil-Waututh nations, known as Vancouver. These are stolen, unceded, and traditional lands of the nations. And as we're going on into this training, we are grounding our work in what we're doing also today as impacts of colonization and what we need to do to become aware of colonization and to undo some of the harms that it has been done. We are going to be discussing some impacts of colonization that is regarding this topic. So I hope that you can ground your work. You are joining from different parts of Canada and Turtle Island, and I hope that you can also reflect how the topics that we're conversing about today relates to the lands that we are on. Who we are. So this is a project in partnership with the Rainbow Coalition for Refuge that is going to be soon called Borders to Belonging. It's a coalition of organizations and people that champion LGBTQI protection and settlement, and Rainbow Refugee is a co-chair along with the Rainbow Railroad. Rainbow Refugee is an organization located in Vancouver, BC. We support LGBTQI refugees and refugee claimants, mostly locally in BC, and some national support as well. And my name is Nazanin Muqaddami. I use she, her pronouns. I'm the Time to Thrive program manager at Rainbow Refugee, and I oversee the psychosocial support that we provide to Rainbow Refugee participants, so all the LGBTQI refugee and refugee claimants. And today we also want to ground our work in, we're going to ground our work in a few principles and knowings. Before I also want to encourage to share or to reflect on some of the agreements that I invite you to participate in. One of them is, if you have any questions, please post them in the chat. My coworkers, Dina and Adam, will be monitoring the chat, and if they can answer the questions, if they can clarify something, they will, and if it's something that I need to respond to, they will just signal me or flag me, and I'll pause and respond. So if you have any questions, please post them in the chat. And if at the end you still have your questions, please, again, post them in the chat. I would also want
Nazanin,
to
yes. Nazanin, sorry to interrupt you there. Could you please stand closer a little bit to the mic?
Yes.
I'm making extra effort to hear you properly.
Okay. I'm going to move my laptop. Let me know if that makes it better. If not, I'll just take off my earpieces. All right. How is it now?
Better for me.
Yeah. How is that for everyone? Can everyone hear me fine?
Way better.
Yeah. Okay. Okay. Thank you, Ada. Thank you. So I would like to also invite you to be open to learning. People are coming, all of you are coming with different expertise and experiences, lived and professional, and there might be things that are repetitive and not new for you, and there might be something that are new for you. So I would like to invite you to being open to that. Sorry about that. and challenging current knowledge. So there's some of the things that I might be talking about might actually go against what you have known or believed or taught. So I would encourage you to learn into discomfort and not make a decision right away, even if this information is aligning with your work or your values. I would really encourage you to take some time to reflect and make this your own. This is based on our own experiences at Rainbow Refugee that this workshop has come through, and also my professional experiences working in this field for a long time. And I would encourage you to make this your own, meaning that finding out how you can integrate this knowledge and use it in a personal way. Okay. So today's agenda is for the folks that we're talking about. We're going to talk a little bit about LGBTQI refugees, some of the unique and particular challenges that folks might face, and some skills and knowledge that we're hoping that you would gain from this. I'm going to share some resources. Disclaimer, most of them are going to be around BC. And we have a poll for you. I think most of you should be familiar with polls. If not, there's going to be a pop-up window on your screen, and there are 2 questions. And if you can answer those questions, that would be great. It would just take about a few, like I think 10 seconds or something. And then Adam will share the results after it's done. Thank you very much. Adam, can you share the results with us? Great, thank you. So just to give us an overview of who's in the who's present, and also what is your skill level. I don't know if you can see the results. Most majority of people are working in the social services and the settlement field with some healthcare and mental health care providers. And most people are somewhat knowledgeable in providing gender affirming support to trans and gender diverse refugees and newcomer. Some folks are not very knowledgeable, and we have one person who is very knowledgeable. So thank you for answering that. We're going to have another poll also. Great. Thank you. So to begin with, who are the LGBTQI newcomers? So it's if you're not working in settlement field or migration or forcibly, like working with forcibly displaced folks, it is not a bad idea to think about why would someone have like leave their country and their community based on their sexual orientation, gender identity, and sex characteristics. The folks that we're supporting, they might have had to leave for various reasons, or they were in Canada and they couldn't go back. So something happened and they couldn't go back anymore. Either the political situation changed back home, or the family found out, or the community found out about the person and they were not supportive. Or the person might have been living out as themselves, and they just couldn't go into hiding again to hide their identity outside. And some of the reasons why people stay in Canada and they might seek asylum and become a refugee from inside Canada. And some of the reasons that people might have had to leave is to get away from persecution and violence that they might be experiencing either in family or in society, systemic discrimination and prejudice. So not having the right to employment, education, cultural activities, meaningful participation in society, so going outside and participating, and being safe and respected in social and private settings. And those are some of the reasons why a person might have to leave. Not everyone who is a refugee who's based on their sexual orientation, gender identity, and sex characteristics, which SOGS, has experienced violence. But these are some of the violent reasons why people might have to leave. For most people, for a lot of people, especially adults, they might have very strong ties to their community and their culture and families back home. Also, they might have been activists and community organizers. So this is important to keep in mind as you're interacting with a person who's here, who might not have community here, who might not have that kind of network around them because they're a newcomer. And these are important as we're looking at a person, as we're interacting with a person that we don't know much about. It's important to really respect the humanity and wholesomeness of them as a human being. We are supporting, so when I'm talking about refugees, we are talking about people who are coming through different pathways of refugees, and these are very different. I would encourage you to, if you are not working in the field of settlement or refugee support, to talk with those who have. These are different pathways with different administration access. And by that, what I mean is, for example, there are refugees here that who, when they get here, they are permanent residents. So if you're sponsored refugee, government or private sponsored, once you land, you are a permanent resident and you have a different kind of access to systems and rights. And if you're a refugee claimant who is claiming, who's submitting a refugee claim in Canada, you have very different rights and access. So you need to apply for a work permit that might take a few months. You are not eligible for income assistance at the beginning, at least in BC. And there's very different varying access to health insurance, provincial health insurance as well. And those are going to come into play when we're talking about gender affirming care for LGBTQI refugees and newcomers. And also we're talking about folks who might have precarious status. So either they have lost their legal status, or they might have been an international student, or they might have been a worker, and they're kind of like in between status, or one status has ended and they don't have a primary precarious status. So these are the population, like these are the folks that we're talking about. And I'm hoping that you will get some skills and confidence also in supporting these folks. It's also very important to know that sometimes we get fearful about supporting people that we think are different than us. So either in terms of race, in terms of gender identity, in terms of sexual orientation, sometimes we have some hesitation or fear of making mistakes or coming across as ignorant. So we don't interact with folks in the fear of making a mistake, or we just don't want to look like a bad person or an uneducated person. What I want to invite you is that to lean into the skills that you already have in the work that you are already doing. Whatever field that you are working in right now, you have the skills, and what we're doing right now, we're bringing that intersectionality today so that you feel more competent and more confident. And also we're adding some knowledge that you might not have. So some practical knowledge that you might not have, so that you can actually use your skills to apply to a more diverse population. You might have also, if you think that you have not been supporting LGBTQI refugees and newcomers, you might actually not know that you might have been interacting with folks just because they might have not told you. So I hope that through this training, you also become more open so that you, in the way that you carry yourself, like in our nonverbal communication and verbal communication, that you signal to other people that you're a safe and all right person for them to disclose to. We are going to read, so this is what we're going to be beginning with. We are going to read a story of a person who I came across. This person was a participant of our program. And it's an email that they sent me about 3 years ago when COVID hit. And this email was a start of a journey at Rainbow Refugee. And I want to share this email with you. It's a very sensitive email and also contents warning. So there's going to be talking about body mutilation and suicidality in this letter. If you do not want to read or hear it, you can just like mute your laptop or your device and just look away. And then when you see like the next slide, just like you can come back, feel free to do that. I want you to take a few minutes to just read through this, and I can, for those who cannot read it, if you put it in the chat, I will read it out loud. But if everyone can read it, I'm just not going to read it out loud. So if there is someone who can't read this on their device, please put it in the chat and I will read it out loud. Otherwise, I'll let you do that on your own. All right, I hope that you had some time to read this. This is an email that we got that started us to really see that, and I will talk about this, administration challenges that trans, non-binary, and gender diverse newcomers and refugees face when they want to be accessing, for example, gender affirming care, medical care in Canada. And this was one of the first emails that I got in my position. And this started a partnership actually with Transcare BC, which is a provincial body in British Columbia that oversees and coordinates lots of trans gender affirming care and gender affirming healthcare. They do lots of workshops. I think BC might be the only province that has a provincial body like that. If you know your province has it, put it in the chat. And what we did, we took this apart in some ways and identified systemic barriers that were listed in this email. And with Transcare actually started a research project based on this feedback that we got to them, that this is inaccessible. Navigating gender affirming care for a newcomer and for a refugee community is very difficult. And they started a research project. It also ended up in us being able to provide their peer navigators who navigate everyone in BC in accessing gender affirming care and connecting them with resources to get training on supporting refugees and newcomers. And we're doing some trans programming and trans and gender diverse specific programming. So this was actually quite important for us as an organization. This person who wrote this email, I'm still in touch with them. They did get their top surgery and they're doing really well right now. I'm very closely connecting with them these days. So I don't want anyone to go home and be worried. But what I also want to invite you is to pay attention to those interactions that you have and finding out what are the systemic barriers that an individual is facing who's sitting in front of you. This might seem like an individual problem, and it wasn't, and it isn't. And really recognize what are the systems, what are the administrative inaccessibilities that the person that is talking to you is really telling you. And if we listen and if we hear, we actually hear the solutions as well. What also happened, and I will be talking very briefly about IFHP, Interim Federal Health Program. What we also found out is we need to do more advocacy, because IFHP, Interim Federal Health Program, does not cover gender affirming surgeries, whereas it needs to match provincial health coverage. It actually doesn't quite do that. Hormones are covered, but surgeries are not. So if people are on the wait list and their name come up, they have to wait until they qualify for health insurance. This is also very province to province specific. It took us a long time to be able to find this information about BC. I would highly encourage you to look up what are some of the places that you can connect to, that you can find out about this kind of information in your province. IFHP coverage is different based on provinces as well, and provincial health authorities are also different. So I would highly encourage you to do some research and do some outreach and connection. I also spoke with lots of doctors, medical care providers, and pharmacists to be able to find this, because there wasn't a phone number that I could call and ask this information. So again, I would really encourage you to do that research. So that's where we're at. That's the kind of like grounding of our work that I wanted you I wanted to invite you to do. What we're dealing with. So again, like what that email really symbolizes for me is historical and ongoing colonization. And what does that mean? When you're supporting LGBTQI refugees and newcomers, it's very important, at least from the point of view that we are working at Rainbow Refugee Front, to recognize how colonization, both locally in Canada and also globally, contributes to creating refugee crisis after refugee crisis. Most recently, we just saw the anti-homosexuality bill passed in Uganda. And it's very important to recognize the role that the US politics played and the US lobbies played in supporting of passing of that bill, and the right-wing movements and the conservative movements that this had. And this is, for me, this is also colonization. And if we trace a lot of countries in the global South and the like homophobic and transphobic laws and rules, we can actually trace it back to colonization. This is important for us to recognize as we're interacting someone from the global South, as a person of color from a developing country, when we're interacting someone, not to blame their culture for the homophobia or transphobia that they might be experiencing, and really recognize the role that Western European and North American countries have played in creating, when I told you about why people leave their countries, in actually creating those conditions and situations why people have to leave. And look at people from a place of empowerment, that it wasn't the individual's fault or their family's fault or their culture's fault. There's no single culture that is at fault for being misogynistic, homophobic, and transphobic. All cultures are misogynistic, transphobic, and misogynistic. And we have to recognize that there is no one single religion or culture or country or nation. And we have to recognize, and we also have to reconcile that there's lots of oppression and discrimination also happens in Canada. So when we're interacting with a person, we really need to recognize the role that other countries play in that person becoming a refugee, and also see the power and the strength of that person and the agency of that person. Grounding our work in intersectionality. At Rainbow Refugee, we support people at the intersections of their sexual orientation and gender identity and their nationality and race. We're working with refugees, so everyone is from outside of Canada, so we're working with countries. And what I have been seeing in my work in this field, I have been working both in the settlement and refugee and immigrant support and also gender affirming care for a very long time, is I have seen a very big divide in settlement organizations and support where they might not understand how they can support a queer person, a trans person, a non-binary person, and also in the queer services, not quite understanding or knowing how to support a newcomer, an immigrant, or a person who have experienced forcibly, who has been forcibly displaced. I've seen people with good intentions, and also I have seen people who frown upon what they call lifestyle. So I have seen lots of homophobia and transphobia in the settlement field, and I have seen quite a lot of racism and acts of white supremacy in the queer and LGBT services. So I want to invite you to come together at the intersections of identities and really meeting the person where they're at in those intersections, so that people don't have to navigate this dual life that if they want to get appropriate gender affirming care, they have to downplay their culture or their identities or their language, or if they want to get settlement support or help with housing or opening a bank account or navigating medical care, they have to downplay their sexual orientation, or they have to lie about who their partner is, that this is a roommate, or be passing as a gender that they don't identify with. Inclusion and diversity kind of goes without saying, without explanation. This is also important for us as we want to become more inclusive. It also means that internally we need to be more inclusive and educated, and also really respect diversity. So I would really encourage you to look around in your workplaces, in your personal communities, to see who's present and who's not present. That's also as important. Who's not at the table, who's not accessing your services, who's not coming into your offices or appointments or services. It's very important to see who's absent. And there's a reason. Again, it's not a personal reason. We can always find a systemic reason why. Yeah, and if there's any questions or comments, please put them in the chat. I'm going a little bit fast, so if you have anything to add, please put them in the chat. Or if you want me to add more context to a point, please let us know. So some of the unique challenges that we have seen folks face in who are gender non-conforming refugees and newcomers. Xenophobia and microaggressions. I have both personal experience with this, professional experience with this, and I also have asked a few of my colleagues to give me some feedback and examples of this. So these can be coming from very well-intentioned service providers or friends or community members, and these are the things that are part of our blind spots. And these are part of what I want you to reflect on and be mindful about when you're interacting with someone who's an LGBTQI newcomer. Some ways that this might come, it can be vary from, oh, you're so lucky to be here. So comments like that. And if I'm saying a comment and you're like, what is wrong with that? This is the perfect place to ask them. This is the perfect place to ask your questions. If you think that you might make the mistakes, this is a great place. And if you don't want to ask in the public chat, just you can also private message me and Dima, and we're going to be answering that. So things like, oh, you're lucky to be here. Things like, oh, it should have been so bad in your home country. You're a trans person from Iran. I'm from Iran. You're a trans person from Iran. It's so bad here. Like, good that you're here right now. And these things, I will just explain the reason why they feel so patronizing and actually not true is that one, you don't know what was it like back home. And also you don't know what is it like to be here and to be a newcomer. So there are two kinds of assumptions that are going on, and I think there's no one here that would assume like that would agree that making assumptions about us is always fun. It disrupts the relationship. It disrupts the relationship with building and the rapport building. Lives are complex. Being in Canada is a complex situation, and living in back home, wherever home was, is also complex. As I said before, a lot of people actually have a lot of community back home, wherever home was, and sometimes home is also a very complex concept for a lot of people because there's no one home. There might have been multiple levels of migration. There might have been many different countries that people have lived before coming to Canada, and Canada might not be the final destination either. And also, we don't know the complexity. Sometimes people have culture, they have access to their food and celebrations and music back home, and there's a big loss of community. Yes, there is more safety here. There's legal protection here, and we all know that legal protection also doesn't mean actual physical safety and protection on the street. Doesn't mean that you have equal access to employment or education or even in dating pools. So these kind of comments that is creating an us and them and doesn't ask questions, isn't approaching a person with curiosity. Those are some of the unique challenges that people face, that maybe a queer person who was born here or passes as white, they might not hear that, oh, you're so lucky to be in Canada, because the service provider might also see the nuances of life here. In Canada, in Vancouver especially, there are so many crises that we're dealing with and we're responding to, that life is not that great here. There's lots of things that are working out, but also there's a housing crisis and there's an opiate crisis. And we just are kind of like coming off the pandemic, which I don't think it's over yet, but there's multi-level of crisis also happening in Canada. So life is not all fun and glitters and rainbows for people when they make it here. Very real experience of transphobia, homophobia, and transmisogyny that people face. I've had many anecdotes of transphobic and homophobic interactions that people have had, either from service providers, from medical staff, from roommates, from employment, and again, from very well-intentioned service providers. And I give you a couple of examples of saying how well-meaning, concerned, kind person can make a mistake. I was supporting a group of settlement workers who were working in employment. So employment support people, employment counselors who were within a settlement organization. I was supporting them in getting some education around supporting trans and non-binary folks. And one of the questions that they had is that if they were talking about people who are transitioning in Canada, if they can pass as the sex that was assigned to them at birth, why wouldn't they just pass to get a job? So for example, if you're a trans woman, why don't you just get dressed as a man so that you can get the job? And that was a real concern that they were having, and they were guiding people that they were supporting to kind of like dress as their assigned gender. And they didn't realize how oppressive it was. And they didn't realize how they're asking people to go back to the closet. And that's a term that is used in North America to kind of like say that you will hide your identity again. Whereas the person who's coming here, the trans person who's coming here, they're coming here to be themselves. People normally pay a big price to become a refugee. And this is also include financial price, but they pay a big emotional, cultural, social, familiar price to be here, and to encourage someone to go back to the cause or to hide their identity, discounts all of that. And this is like a well-meaning comment, and we've also heard very outwardly, and I'm not going to repeat those, but very outwardly actually misogynistic and transphobic comments. Transmisogyny is a form of misogyny, so hatred of women, misogyny that trans women face. And it's very specific to trans women, and it's a very real thing, and it's a very widespread thing. It is not a cultural phenomenon. If when you're working in gender-based violence field, you also see like the risk of sexual assault and gender-based violence really increases when we're talking about trans women and trans feminine folks. The society just can't accept that someone needs to like would become a woman or is presenting as a woman who has always been a woman. So these are very real challenges that people face. And then administrative inaccessibility. And I was thinking about how do I frame some of the challenges that folks face, and this is the kind of term that I came up with. And this especially goes into access to healthcare, access to resources, and access to services. Access to healthcare. So remember the refugee pathways that we talked about at the beginning? Depending on how you got to Canada and your status in Canada, even if you have been here a long time, you have different kinds of access to healthcare. That also depends on your province and the regulations in your province. In BC, until you have your refugee claimant ID document, IMM 1442B, I think it's called, until you have that form, you cannot apply for MSP, which is the Medical Plan Services, the provincial health insurance here. And unless you file your taxes, you can't also apply for pharmacare, fair pharmacare, which gives you access to some coverage for medication. If you are a refugee claimant and have submitted your claim here, or if you are a sponsored refugee and you are landing, you are automatically enrolled in IFHP, Interim Federal Health Program. And I'm going to talk very briefly about IFHP, but I encourage you to do your research and talk to doctors and pharmacists about this. And those are your best resources. Wherever you are in whatever province that you are, it's what I have found is speaking with those folks are one of the best things. I have also spoken to BC Center for Disease Control and Transcare BC. And I think each province should have a Center for Disease Control clinic, I think. And those also could be a very good resource for you. So administrative inaccessibility. Navigating IFHP, at least in BC, has been quite challenging. I am very fluent in English. I have lived in Canada for a very long time, and supporting people into navigating IFHP has been almost impossible. Understanding how the insurance work and what is covered and what is not covered and how the coverage works and for how long and the referral pathway has been absolutely mind-boggling. So when we're talking about colonization and how colonization shows up in administration, this is one of the ways that we're talking about. This is not the individual's fault. This is a systemic barrier. Another thing is access to social services. There are social services, government services that are not available to all refugees and refugee claimants. That includes the employment counseling. So if you are a trans person who's a newcomer, who don't have Canadian job experience, who wants to work on their resume, at least in BC, you don't qualify for a lot of the employment programs because most of them are funded by federal government, and the federal fundings do not apply for refugee claimants. If you're a sponsored refugee or if you're an immigrant, you do qualify for them. So it's also understand, as we want to become competent and we want to support LGBTQI newcomers and refugees, it's important for us to know the system so that when a person comes in with their challenge and what they're really grappling with, we can understand which part of it is actually systemic so that we can support them in navigating the system and not making a personal choice and not asking them, well, have you tried this and have you tried that? Because a lot of the times people actually come with a lot of openness and they try and then they get disappointed over and over, and at some point they give up and they don't try anymore. So it is our job to understand the system, identify the systemic barriers, and support the individual also in gaining that knowledge. So when I'm supporting people in when they want to access healthcare, I actually tell them about the systems, because a lot of people come thinking that there's universal healthcare in Canada, and there isn't. It doesn't apply to everyone in the same way. And they take it very personally. Is that why is that I cannot access healthcare? Why is my life so difficult? So it's very helpful for us to also make it not personal, so that we can support the person in saying there is a system at fault here, and I'm going to be with you, and I'm going to advocate for you, and I'm going to use all the systemic power that is given to me so that I can make this accessible for you. And we're going to be doing this together, and I'm going to involve as many organizations as I can in supporting you that way. I hope that it's not too heady, this conversation. So if you have any questions or comments, please let me know. If you want me to pause to take this in, especially if you're a little bit new to navigating IFHB, please let me know. And if there isn't, we're just going to continue. Again, at any time, if you needed me to pause, please just put that in the chat or send me a private message.
Hi, can you hear me? Hi.
Yes, I can hear you.
Sorry that I joined late because my previous meeting ended very, it took too much time, sorry. And thank you for the information that you provide. I am in settlement work job, but the problem, like you said, IFHB for trans people is not covering the medical care for the trans people. So what is the solution? This is one of my challenges as well. I don't know where to refer clients. I'm located in Ottawa, not in BC.
Right. So I would highly recommend you connecting with other queer and trans service providers who are doing healthcare. So again, I don't think that Ontario has a provincial body that oversees gender affirming care. But if you can connect with, I think 519 might be a good resource. Actually, Dave, I'm going to put you on, yes.
Yeah, so in Ottawa, there is Max Ottawa.
Yes.
Again, I'm not sure exactly what kind of services they provide, but I know that they shared that they deal with health service providing in Ottawa. Also, we do have representatives from Capital Rainbow Refuge here, so if they know as well, please jump in and share the resources that you have.
Thanks.
Yes, Max Ottawa would be a very good resource as well. And Noah, I see your hand up. Maybe you have a response for Razia.
Yeah, so I'm located in Ottawa. I have a background in doing trans health navigation in Ottawa. And so the Centertown Community Health Center sees newcomers and refugees who don't have insurance. Of course, there's a very long wait list, but there's no issue with those providers seeing newcomers. And there's a trans health clinic in that health center as well. So I just wanted to share that.
Thank you.
Great. Thank you, Noah. And Dave, you also have your hand up.
Right. So I can also confirm that the 519 has a program, a trans care program. I'll just find the information and put it in the chat shortly.
Great, thank you. And this is kind of like the good part of IFHB is that it encapsulates the province. So if you can find information, and Toronto might have more information. I think Ottawa also has a lot of like resources. If you find information from Toronto, it will apply to people in Ottawa as well. So it's not all grim. There's also like a good thing about that is provincial. What we have done in BC is there has been no way around it to support people in accessing gender affirming care when they're using IFHB. So what we have done with TransCare is we have agreed that people can go on the wait list for gender affirming surgeries, and they wait, and while they're waiting, Rainbow Refugee, we support them to get the provincial health because they have coverage through that. And the issue is that now the wait lists are shrinking, and it's going to be more likely that their name might come up for gender affirming care and they don't have coverage, so they just have to wait until they get their MSV. which for some people can be quite devastating, and for some people it's actually quite okay for them to wait. So finding out the way around it, the first step would be finding out information. If you have knowledge about it, please actually share that with me. Dima's going to put my email in the chat. Thank you, Dima. Email me the information that you have. We can, at Rainbow Refugee, we can talk with IRCC. IRCC is not the provider of IFHB. Medavi Blue Cross is. IRCC, Immigration, Refugee, Citizenship Canada, contracts Medavi Blue Cross to administer the insurance. So we can speak with IRCC, and we have spoken with them. So if you have used it, you have realized that the website has changed. And I want to believe that that has something to do with our advocacy. It's not perfect yet. It's still a very difficult thing to navigate. And again, you might find like very convoluted ways of navigating IFHB. That's what we have done. We have found ways that are wraparound that are just very, very convoluted, but it works. Okay, any other questions or comments? Okay, great. So what to do? So these are all the challenges. Well, these are not all the challenges. These are some of the challenges that folks might face, from xenophobia and racism to misogyny and transmisogyny and homophobia to administrative inaccessibility. What are some of your roles? What can you do? Education and training. And this is very important, like the things that you're doing right now, the kind of conversations that you're going to be having with other service providers, listening to the people that you're supporting. If you're in direct contact with people, if you're doing frontline work, really hearing what they're saying, listening and thinking about what is it that you can do? What is it that a person that you know can do about this, and not taking it as a personal problem, and really recognizing the systems, getting educated in those systems and finding ways to navigate those systems as well. And with education and training, we're going to talk a little bit more, and like I'm going to unpack this a little bit more, expanding professional and personal communities. We are the most, we are creatures of comfort of humans. All humans are. All humans also, I believe that we grew up in racist, misogynistic cultures, wherever that we were born, wherever that we grew up. Unfortunately, this is just the zeitgeist of our time. So looking at, and we are the most comfortable working with people who in some ways we relate to. And if our community is LGBTQI newcomers, that's great. If it's not, we might be uncomfortable relating to someone who has had different lived experiences. And that's where diversity comes. So looking at our personal and professional communities and see who's there, who are the most of the people in our communities, and who is missing, who is absent. From our colleagues, from the leadership in our organizations, from other service providers, from our friends and communities, who are the people who are not there? And being mindful of that. And I'm not encouraging you go and get diverse friends, but really being mindful of what are some of those reasons. Why is it that I don't have a colleague who is X, Y, and Z? And becoming aware of that. These are the network that also feed us information from the casual conversations that we're having, from formal conversations that we're having. These are some of the ways that we actually gain knowledge and experience in diversifying and being able and open, and also be safe people for people to approach us. Awareness and critical thinking. As you have seen through this presentation, there's a questioning of why a system is working the way it is. And what is it that you can do? So not accepting the systems, especially if they're designed to be exclusionary or oppressive or discriminatory to certain populations, really building our awareness and understanding and being able to question. We at Rainbow Refugee and at BC, we were able to get here because we were able to ask those questions and connect with some other organizations and like-minded people who also believed in the same thing and would be able to respond to us. And we go back and forth in asking those questions. And sometimes it's not very, it gets a little bit messy. But as we want to diversify, as we want to ground our work in intersectionality, inclusion, and diversity, we need to also welcome the messiness that might come, this the unsettlement that might come with it, as we're also, again, impacting the unpacking the impacts of colonizations. Building connections and community relationships. This is actually just what happened right now. So getting connected to organizations locally, provincially, and nationally who are doing the same work or similar work or related work. So Transcare BC isn't doing similar work to us, but is working very related work to us. BC Center for Disease Control, they're not doing similar work than us. We are a refugee support organization, but they're doing work that is very relevant to us, and we're actually a collaborator of each other right now. So building those community connections, and also as we're building community connections, as we're building connections with the people also, with participants, we can hear feedback and we can learn and unlearn. The community is always changing, and it's very important for us to keep up to date. Learning. So if you have noticed, I have very intentionally not included any terminologies or identities in this presentation because it's always changing. There is a resource that, Dima, actually, can you put that in the chat, the community's glossary? This is a resource that was developed, Dima's going to put that in the chat. It's a PDF of, it's a glossary. It was developed by community here. It's a non-profit organization here. And the reason I didn't include that is that terminology and identity, especially in both the LGBT and queer community, and also in the forcibly displaced communities, is always changing. It's always upgrading. What we used 10 years ago might not be actually acceptable these days, or what was offensive those days is actually reclaimed these days. So even the word queer used to be a slur, and it's been reclaimed by the queer communities, by the younger people also. And so it's important to learn terminology and identity, but also I want to caution you against getting hung up in using the right term. Because what you really are bringing forth in your work is your internal respect for a person, not the language that you know or the terminology that you know. If you have the right attitude and you use the wrong word or mispronounce someone or use the wrong identifying information about someone, if you are safe enough, if you have signaled openness enough, if you have built that connection enough, they will correct you. And if you make a mistake, and if you make a mistake again, and you hurt someone or you harm someone, you can mend that. There are skills that you can build with practice so that if you make a mistake, if you have done harm, how to mitigate the harms that you have used. And it's a bit beyond these workshops for us to do that, but I would really encourage you to do those works as well, to do those trainings of what to do if you make a mistake and how to handle it personally. And I will just give you a quick tip. Don't make it about you and how sorry you are and how amazing you are that this was just like a slip. It's about the other person, and you're going to deal with your emotions on a separate time. Sometimes we have lots of emotions, again, especially if we want to be an ally, if we want to be a good person, we have lots of emotions when we make mistakes, and it's not the other person's job to take care of our emotion and how sorry and ashamed we are. Even if you really genuinely feel that way, deal with your emotions on a different time. Realities of transgender, diverse, and non-binary folks. It's very important that we learn about stories and their experiences. You can do this by talking to people. You can do this by watching movies that were not made in North America, that were made by people, listening to interviews, reading stories. And at the same time, it's very important for us not to tokenize a person and look at them as an information resource. Just like you do with a person that you're just chatting about, you can chat with them and be very respectful about when you ask questions and why you're asking questions. If you're curious, and this is your personal curiosity about a person, it's very important that as service providers, you name that as a personal curiosity that has nothing to do with your work. What we see in a lot of LGBTQI newcomers is that because they ask so many questions that are very, very private, especially if they have been here as a refugee person, they had to tell their stories in great detail to many people before they were able to make it to Canada. So if you ask a question, it's very important that you equalize the power and not say that, like, if you want service, you need to tell me what happened. If it's a personal curiosity, really naming it as a personal curiosity. Because in there have been a lot of situations that if people wanted service or if they wanted something, they had to actually open up their traumas like even in Canada, from income assistance, like why you need that $20 to get food, like you have to open up quite a lot. So listening and learning about those stories without tokenizing or pressuring the other person or exotifying them or looking at people as a source of inspiration or anything like that. And if someone shares their story, if they feel comfortable and safe enough with you, just saying a thank you. Again, like those microaggressions that we mentioned a bit earlier, that people say, oh, wow, you're such an inspiration. You're so strong. Even though they might be well-intentioned, they might land in a very patronizing way. The same way that if your friend is doing something amazing, you're just going to be kind of like cheering them up and say, well, thank you for sharing. I'm so glad that you trusted me. Maybe not with that tone, but like, I'm so glad that you trusted me, blah, blah, blah. But you're not going to be, wow, you're such an amazing person, because a lot of the times we also need to recognize that people didn't have a choice. We didn't choose to be brave. We didn't choose to be courageous or anything. There was just no other way. Or resilient. Resilient is another word that has become very tricky, and people just like, oh, you're so resilient, in a way that it shuts down the conversation. A lot of the times people didn't have any other way besides tolerating what was happening to them and besides just going forward. So it wasn't a choice. And learning about intersectionality, where did intersectionality come from? So actually reading original work that introduced intersectionality to the field, and reading what is it about, and then how does it apply to your work? And again, really learning about who's present, who's not present, who's accessing, who's not accessing, and what are the systemic ways that make this happen. Unlearning. So terminology and identities. This is also where we need to unlearn some terminologies and identities. There's lots of myths about people in general. There's lots of assumptions about people. So assumptions that refugees were helpless, assumptions that newcomers are going to have a great life in Canada, myths and misinformation about transgender, diverse, and non-binary community, outdated terminology. Again, I put terminology in both learning and unlearning. It's important and it's not the deal breaker. If you don't know the right terminology, use descriptors. Describe people. How would you describe to someone who doesn't know that term? Use those words. You're going to get nuance learning once you start using this with intention. You're going to get feedback from the community. You're going to get feedback from other service providers, and that's why you learn. This is not a process to be rushing it, and this is not a process that you will do one training and then it's done. This is a process. This is a work in progress. So really understanding those myths about newcomers. When I came here, a lot of people asked me, "Wow, your English is so good. How did you learn English?" Assuming that I somewhat learned English in Canada, and I didn't. And that's the reality for a lot of people. A lot of immigrants from the global south actually speak English as their first language, so not assuming that the only right way to speak English is the Canadian or British or the American way. Or if someone has darker skin compared to yours, they might not be able to speak English. Everyone has a language, either it's sign language or spoken language, but everyone has a language, and just really respecting that. And learning about myths and misinformation, again, about trans and non-binary people, around the LGBTQ people. I'm not going to repeat some of those myths just because they are harmful, but recognizing and knowing those myths will also help you when you're supporting a person who is trans or non-binary, because they might be saying to you that they're being hurt by those myths without naming it. And it's your job to be able to connect the dots and say, oh, that's a misconception, and I understand, and you're not the only one who's dealing with that. Unlearning some of the values, ideas that we have learned and they were taught to us based on our upbringing, our culture, our family, our schooling, and media. This is also very important, and this is our personal work. Everyone here comes from diverse backgrounds. I did my post-secondary education in Canada, and when I was going through my undergrad, I did not learn anything about colonization or Indigenous history in Canada at all. So this was, and what I had learned was quite the opposite. So I had to do a lot of learning and unlearning. And that's just one example. So when it comes to supporting queer, trans, non-binary, newcomers, and refugees, there's also lots of education, formal and informal, that we have gotten. There's lots of myths and misconceptions that we learn as kids or growing up about people that are just not true, that are based on media, based on the political environment, or based on misinformation. And it's important for us to recognize that. Being north of the US makes it somewhat easier for us to understand some of those because of like what is happening in media right now, especially around trans folks. Unsafe organizations, and that's what the trigger warning is about. The content warning is about. So recognizing also what organizations are not safe in around for your work. I'm going to name one of the organizations in Vancouver that have been quite exclusively transphobic and trans-exclusionary. They had a lawsuit that they won, actually, quite unfortunately. But they just don't recognize trans people as trans people. And that's Vancouver Rape Relief and the Women's Shelter, and they just don't recognize trans women as women. So it's also very, very important to recognize organizations that are not safe. So when you're doing a referral, when you're supporting someone who might really be a fit in otherwise for that organization, and they send them and they're transphobic or they're absolutely racist, you lose that trust, and also you might have put that person in harm's way. We cannot absolutely 100% all the time know what kind of a treatment a person can get, but we can identify places that you will not refer to. And there are some organizations in BC that I will not refer to because of the harms that I have heard they cause. So I just don't refer to them. So it's important in your area to also identify those organizations, whether they are homophobic, transphobic, or you know that we also have seen some organizations that they refuse to get training, that they're not interested, and building those connections. So what we talked about, like building those bridges and building those connections, this is how you're gonna find out. And you can, like, over time, you can say, go see this person, so-and-so, at this particular clinic or at this particular law office, because I know that you can trust them. And as you're doing it, you can get feedback from people about what their experiences has been. So if I know a person, also in that, trust that people can make their own decisions. Don't make a decision for a person. If I know there is this particular person that doesn't respect people's chosen names and only uses legal names, I will tell that to the person and let them decide. I will tell that, like, you can get legal information and this is the reputation that this person has. So you might be dead name. You might be called by your old name that you do not want to be called. And do you want to take it, or do you want me to look into another place for them? And really trusting that this person is going to tell me, because sometimes people kind of say, like, you know what, it's more important for me to get that resource rather than be called with my chosen name, or they say, I don't want to be doing a compromise. But really recognizing that sometimes also you can trust the person with having agency and making the best decision for themselves rather than making those decisions for them. Any questions or comments about this? If not, we're just going to go to the next one. So these are some resources. Again, most of them are going to be BC based. So I put ourselves as a resource because we are, and we do support the province. We have people from all parts of BC that reach out to us, and sometimes all other parts of Canada. Transcare BC is a very good resource. And again, unfortunately, I don't think other provinces have such a body that oversees provincial care. I think Yukon might have something in the building, and they're really trying and they're doing a very good job, but I don't know other provinces. I belong at Mosaic. It's a group that runs for LGBTQI newcomers and migrants. So second generation folks can go there, and they have been a sister or group for us for a very long time. Catherine White Home and Wellness Center, that's a place that provides gender affirming assessments. So people who want to access surgery on hormones and also legal navigation. So for gender recognition and name recognition on legal documents, so changing your name or gender marker, which also is a bit of a complicated and complex process for a newcomer compared to someone who has a Canadian birth certificate. That's a resource in BC. Community the Queer Resource Center, they hold a lot of groups that you can access. Thank you, Daru. Daru is also saying that the LGBTQ MAP program at ISS of BC, which is a case management program at Immigration Settlement Services of BC. Community health centers. Again, I don't know how is that in other provinces, but we have this new kind of health centers, community health centers, and also urgent care centers that they're popping up around BC that have very, very good training, all their staff from the medical office administrators to nurses to doctors. We've had very good experiences, and there's a couple of centers that also see people without requiring them to have health insurance. And IFHB, IFHB is such a such a difficult thing to navigate. But really speaking with people, so there is no single resource that I can point out that you can get information about IFHB. There's minimal information on their website, so it hasn't been very informative to reach out to them. But what I have found helpful and what I encourage you to do is to reach out to service providers, so people who do direct billing, from physiotherapists to counselors to doctors to pharmacists to nurses, to speak with them and see what is the billing like for them. And from that information, you can actually build up the resource. So that's what I have done. I have sat down with a pharmacist and asked them about their billing codes and things like that, so that I know what hormones are covered at what stage, and what is the transition like if a person transitions from IFHP to MSV, what happens to their coverage. So actually speaking in, and don't be afraid of like, if you're not working in healthcare and like there's technical information, don't be afraid of that, you can handle it. But that has been the most helpful and informative about supporting trans and non-binary folks in accessing gender affirming care, because I can tell them with confidence that if you want this particular hormone, this is covered, this is not covered, this aspect of this medication is covered, but that aspect is not covered. And also this is the way to access it. So IFHB also has a different way of getting special authority. If in BC, if you have MSC, if you have provincial coverage, you can get special authority to get certain medication covered. And for IFHB, the process is slightly different. The doctor doesn't approve the special authority, it's the pharmacist actually that does that. So helping a person, so I can tell because these are, again, think about that administration in accessibility. A newcomer who's learning about a new healthcare system because they already know their own healthcare system, or they might have left early, they might have not had that experience, but they're learning about a new healthcare system, and I'm talking to them about special authority approval. This might go a little bit beyond them, so I actually write it down, and when it comes to IFHB, I give them very specific instructions about go to this particular pharmacy and say this particular sentence about who you are and what you have and what you want. So by learning about the system, I can give very detailed and very specific instructions so that they can go and get the medication covered. And this might sound a lot of work, but this also is a work that takes some time because the system wasn't designed to be supporting LGBTQI newcomers and refugees. We are making the system more accessible. For other territories and provinces, I highly encourage you to find out direct and indirect resources. So there will be direct resources that they provide, like direct person-to-person resources. And there are resources that might be more relevant to staff. And they might be more relevant to give you information about how things are. So a manager of a clinic, of a healthcare center, they might not be a direct resource, but they might be a good resource for you to call and ask questions about healthcare access. Or a clinical supervisor at a counseling center that provides gender affirming mental health, they might be a good resource for you when you have a question, and they can be a good resource for you. So building those connections and resources, I think that would be quite helpful. If you are aware of some of the resources in your province or territory, if you can put the province and the resource, or if your organization is a resource and you can be available to other people, please put that in the chat, and also just specify what sort of resource are you. So I think like you have MCC Toronto, I think like those would be a great resource. If Max Ottawa is here, or anyone else from the Coalition for Refugees here, I think those would be amazing resources for people to be aware of. And before we go to poll number 2, any questions or comments? You can put that in the chat or actually just raise your hand. Okay. If not, Adam, could you post the second poll? Thank you. So if folks can respond to the poll, that would be fantastic. Thank you very much. And So thank you for attending this workshop and this training. I hope you found it helpful. Oh, that's fantastic. 80% find this workshop helpful. I'm really glad to hear that. Thank you very much for attending. We do have another workshop coming up on April 17th. To find out information about that and to register for that, please get in touch with Dima at rainbowrefugee.ca. Dima, can you put your email in the chat as well? And the next workshop is about sexual health and mental health in LGBTQI newcomers. And is it the BC Center for Disease Control that is running it with you? Yeah, so it's a collaboration between Rainbow Refugee and BC Center for Disease Control. So I highly encourage you to come. And Dima, can people share that with like people in their organizations and open to the public as well? Like participants and members can come? Yeah, great. So if you, and it's open to everyone, so not just only people to BC. So if you have participants or members who are also interested in learning about sexual and mental health for newcomers, please share that information with them. Email Dima directly, dima@rainbowrefugee.ca. And I hope you have a good rest of your day. Thank you very much, and bye-bye. Adam, I think we can end the meeting.